My name is Heun. I'm a professor of psychiatry, and I'd like to talk about delusional disorder today. In principle, it's a quite uncommon condition in which patients describe circumscribed symptoms of non-bizarre delusions. We come to what's bizarre later. But the delusions, and most importantly, are not with hallucinations. People don't hear voices. People don't see things which are not there. There's no thought disorder, so no neologism, no mood disorder, or what they usually have in schizophrenia, flattening of affect. So usually these symptoms should be persistent, and there should be at least 3 months. So it's usually a little bit of a dimensional issue, that people don't have diseases precisely by 3 months, by 1 month. It's usually floating things, and the months or sometimes the years are a best estimate. So the different subtypes of the content, concerning on the content of delusional disorder. One is erotomanic. It's also described after a French psychiatrist, the Clérambault syndrome. And people believe that some important person is secretly in love with them and may make efforts to contact them, to think about them. And usually, sometimes it's related with stalking. I once can remember a 60-year-old woman who was felt a German comedian was in contact with her and would be in love with her, and she then was absolutely convinced that he would reciprocate her love as well. Grandiosity is another subtype, so people believe they have a specific religious function. Sometimes they think of Jesus. Recently had someone who said he's God-like, but he might not be God. But he also felt that all these human legal regulations wouldn't be relevant to him, who is godlike. The other thing which is common is Othello syndrome, after the figure which was described by Shakespeare in the 17th century. It's about jealousy, and patients have the fixed belief that their spouse or partner has been unfaithful, and they try to find evidence for that, or try to also restrict their partner's activities and make sure that they don't have any contact. And sometimes this might lead to stressful arguments, and some people murder their loved ones. Persecutory delusions are very common, so that people feel they're followed, or some people come and are after them. They want to poison them, or want to have relationships, want to have their wealth and take things away. Sometimes that happens with dementia, that people have these persecutory ideas that that people are stealing from them, or following them, or looking at them and trying to harm them. There's also what they call somatic delusions, that people present with physical health problems and request sometimes dramatic medications or dramatic surgical procedures to have a treatment which they feel that they need to be addressed. So that could be that people feel that they have infestation in their skins, or that their arms or legs are deformed, or so there's some overlap with body dysmorphic disorder. But when it's delusional, that people have more or less some ideas which are not just being ugly or something like that, that people have done something like that, or other people have bent their arms, or other people have made their ears bigger or longer, or whatever. Usually there's mixed presence. Some people have different types of delusion at the same time, and sometimes the delusions can't be distinguished. So what's important, that these people very rarely go to the psychiatrist, because they're absolutely convinced what they do, and these complaints against others who follow them, or are unfaithful to them, they usually go to lawyers and or to the police. And when you assess these people, you have to be very careful because they don't believe in you. I had a recent patient who felt that the government was going to poison the whole of the population with some gases and some whatever pollution. So he took this pollution, which we all believe in, to the next level and believed that the government was doing a job and trying to destroy their people. Right. Sometimes it can be very difficult. People might have these delusions for years. So sometimes it's, let's say it that way, especially with environmental things, it's very difficult to distinguish delusions, that the government does something, people are behind things, and these valued ideas or overvalued ideas that we all need to do something for the environment in different ways. So the question is also what's relates to the culture. Sometimes it's that there is some systematic thinking about that, some complexity. So when the government does things, then sometimes they have to hide it, and they sometimes come to very complex ideas. Sometimes I have seen people who felt they had the delusion that they're married to or whatever, that they inherited or have whatever inherited children from the king or are related to the king or whatever are the daughters or fathers of Prince Charles. So that is something common or not too uncommon, but people wouldn't have delusions about someone who is not famous. So usually famous people are something which people are much more deluded about. So it's important to see what's the culture in this, whether there are hallucinations, whether there's a change in personality. Let's say in that way, this belief that that whatever the world is going down, does it lead to a change of the personality or the change of the behavior? So the question is, what can be observed, what can be seen? Is there mood? Is there some delusional content in what they think? Is there some emotional relation to that? Is the question is the thought process generally unimpaired? And so even though people are preoccupied with something, does it really affect their normal thinking about other things? So if there are hallucinations in these circumstances, they might be very rare. If they're consistent, then we would possibly call it schizophrenia or schizoaffective disorder if affective things come in there. Right, okay, so usually delusions are quite uncommon. The prevalence is whatever, is more than or less than 0.25% or even less than 1 per mil of the population might have that. It's maybe 1% of the hospital population. The fact is, anxiety and depression very often don't lead to hospital admission, even though they're mental health problems. Usually the more severe problems lead to hospital admission, so we very often have what we call a Bergson bias, which is a hospitalization bias. Advanced age is a risk factor, dementia is a risk factor, people who are socially isolated. Sometimes you have group delusions. The question is if people feel that the end of the world is coming and they have to starve themselves to death, or that they have a better deal in heaven. Question is this a religion? Is this a delusion? And people might have a delusional thought about that. The question is also, what is the family history? Is there a substance abuse disorder? Substance abuse disorder and severe head injuries can lead to delusions. And very often the onset might be very slow. People might have talked about something and this becomes only relevant much, much later. Usually people have, can take an antipsychotic. The remission, there's some remission, and there's some people who consistently improve, 1 out of 10. and but maybe nearly 50% have a long-term delusional system. Usually, if it's acute, as most days you have less problems. When stress is a factor, then it's getting worse. Jealousy and persecutary subtypes might have a slightly better outcome, and if the symptoms are only for a short time, then it's more likely they stop. Anyway, so if you're interested in these types of explanations of common mental health problems, you might or you might not see, and you might want to know about, please subscribe to our channel. We will provide you with new information, and hope you enjoyed this, and you can easily hear our talks on the radio on the way to work if you don't want to see my face. Anyway, have a nice evening and goodbye.